Now, what is the most useful test for the detection of early renal dysfunction? The renal dysfunction in a very early phase, how can you be able to detect it? So you should remember it is the creatinine clearance, which you need to remember as the earliest way by which the renal dysfunction is identified. So how do we calculate creatinine clearance? So we take how much creatinine is there in the urine, that is in milligrams per deciliter, into total volume of the urine divided by how much creatinine is there in the serum, concentration of the creatinine in the serum, which is calculated as milligrams per deciliter into 1440 in the denominator. So typically, what is the creatinine clearance? Creatinine clearance is around 125 ml per minute. How much? 125 ml per minute. This is also a favorite question of the examiner in a lot of staff nurse exams, recruitment exams. And if there is any decrease of this creatinine clearance, it is a very sensitive indicator. What is meant by sensitive indicator? At a very early stage of the disease process, if you can detect it, you call it as sensitive indicator, very early stage. Then what is meant by specific indicator? Two words you should understand: specific indicator, sensitive indicator. What is the difference? Any test has two things. One is sensitivity, other is called specificity. So sensitivity is typically a feature which says how early a particular diagnostic test can detect. How early? If it can detect in a very early stage of disease, if the disease can be detected by using a diagnostic test, what is that called? Sensitive. Once more, aur ek baar mere saath bolo. Once more, you tell along with me. Sensitive is early. Specific means if this test is positive, then this diagnosis is positive. That is called specificity. So creatinine clearance is a very sensitive indicator of the glomerular filtration rate, is what you need to remember. Now, the normal mean pulmonary artery pressure is how much? You need to know what is the pulmonary artery pressure, because few people develop an entity, a condition called as pulmonary hypertension. It is called pulmonary hypertension. So that is the reason you need to know what defines pulmonary hypertension. But let us have an understanding as how is the circulation of the heart. If you know that, you can be able to answer this question. So I will take you for that. Yes, let's take the whiteboard. So let me draw the So let us say this is the heart. Heart has 4 chambers, you know very well. There is a right atrium and there is a right ventricle. Then there is a left atrium, very good, and there is a left ventricle. Great, this much you know already. You're already a cardiac nurse, right? Now, there is an aorta which comes from the left ventricle. And what enters into the left atrium? Here you have the lungs. From the lungs, the blood gets purified and it comes into the left atrium. So from the lungs into the left atrium, what do you call this? You call this as pulmonary vein. Generally we think vein means bad blood. No. Pulmonary vein has good blood, oxygenated blood. Then What comes out of right ventricle? You have a pulmonary artery. So what will this pulmonary artery do? Does pulmonary artery become pulmonary capillaries? Pulmonary capillaries combine to form will typically flow into the lungs, and in the lungs they get oxygenated, and from the lungs this pulmonary vein comes and drains into left atrium. That's how the right ventricle, which has deoxygenated blood, that is, right side always has got impure blood, right? So deoxygenated blood which is there in the right ventricle, which came from throughout our body, right? So that passes into the pulmonary artery, goes into pulmonary capillaries, gets purified in the lung, and then it will come back to the left side of the heart. That is called the circulation. That is a typical circulation. Then who brings the impure blood into right ventricle? It is the right atrium which brings. From where the right atrium gets the blood? Let us talk about it. Right atrium gets the blood from two sources. The impure blood which is coming from the head and upper part of the body, what is that called? Superior vena cava. And the impure blood which is coming, deoxygenated blood which is coming from the lower part of the body, what is that called as? Lower part of the body. That is called as inferior vena cava. So both of them bring the impure blood into right atrium, passes it into right ventricle, and from right ventricle they pass the blood into pulmonary artery. Keep telling along with me, then you will be able to remember. So from the pulmonary artery, the blood will pass into the lungs and it gets purified. It forms pulmonary vein, and the pulmonary venous blood will come into the left atrium, and from the left atrium the blood passes into, this is all good blood, into left ventricle, and from the left ventricle it will go into aorta, and through the aorta it will go throughout our body. So once more you repeat, superior vena cava and inferior vena cava. They bring the blood to the right atrium, that goes into right ventricle, that goes into pulmonary artery, that goes into lungs, and that comes out as pulmonary vein, goes into left atrium. From there it goes into left ventricle. From there it gets distributed throughout the body through aorta. So we check the blood pressure, right? So where is this pressure? This is the pressure of the blood coming from the aorta and going into our hands. Here you have the radial artery, right? So you are checking the blood pressure in the radial artery. Indirectly you are checking the blood pressure in the aorta, and that way you are indirectly checking the pressure in the left ventricle, and this is called as systemic blood pressure, right? In that you have the pressure when the heart contracts. What is that called? Systolic blood pressure. When the heart relaxes, what is that pressure called as? Diastolic blood pressure is what you need to remember. Whereas in the pulmonary vessels, if you take, the pressure in the pulmonary artery is a reflection of the pressure in the right ventricle, the right side of the heart. That is what you need to remember. So now the examiner's question is, what is the pressure, mean pressure in the pulmonary artery is the examiner's question. So what is your answer, doc? So you should remember 10 to 20 millimeters of mercury. Just like you have 120 by 80, we call systolic and diastolic in the systemic circulation. That is when you are checking the radial artery. So 10 to 20 millimeters of mercury is the normal mean pressure. If this 20 millimeters of mercury up to 20 to 40 millimeters of mercury. If the pressure increases, mean pulmonary artery pressure increase, you call mild pulmonary hypertension. Just like systemic blood vessels have got, that is with the BP what you are checking, the systemic blood pressure, the way it has got a systolic and diastolic and a mean pressure, similarly pulmonary artery also has got a systolic, diastolic and a mean pulmonary arterial pressure. So that is what we are talking about. So 20 to 40 millimeters of mercury we call mild pulmonary hypertension. 40 to 60 millimeters of mercury we call moderate pulmonary hypertension. Moderate pulmonary hypertension is a favorite question of the examiner. In the tomorrow's exam, you may be going for RRB exam, or you may be going for the State Public Service Commission Staff Nurse Recruitment exam, or NCLEX exam, or if you are going to Abu Dhabi or Middle East, you'll be taking hard exam, etc., etc. For any exam, fundamentals, basics are very important. Next 200 hours, I'm going to make you very strong by discussing about 8,000 MCQs and the concepts in all the 14 subjects which are often tested in the various nurse recruitment exams. So 120 by 80 is the systemic blood pressure. So 20 to 40 pulmonary artery pressure is called mild pulmonary artery pressure. 40 to 60 is called moderate pulmonary hypertension. And 60 to 80, anything above 60 is called as a severe pulmonary hypertension. If the pulmonary artery mean pressure is more than 60 millimeters of mercury, you call severe pulmonary hypertension. That is what you have to basically remember. So this is what we are exactly discussing, which you need to remember, that you have a right atrium going into right ventricle. From the right ventricle, the blood will go into pulmonary artery. Then from left atrium, the blood comes into left ventricle. From the left ventricle, the blood goes into the aorta, That's what you have to remember. So you have the pulmonary artery, the left and right pulmonary artery. Both the left and right pulmonary artery are opening into what? Into right ventricle. So we are talking about the pressure, the mean pressure in the pulmonary artery, you should remember, is up to 10 to 20 millimeters of mercury is what you are going to remember.